Hello and welcome to Series 2, Episode 7 of In Conversation with a CEO. And today I'm joined by Dr Raphael Ogbolu, who is a consultant psychiatrist and also the Trust's medical lead for the Suicide Prevention Working Group. In this episode, we're going to be talking about suicide and bereavement, and I encourage listeners to take care if this may be something that is emotionally challenging to hear. At the end of the podcast, we will be sharing a full range of resources to help listeners should they wish to explore any further support. So, Raphael, welcome to the podcast.
Thank you.
This podcast is really well timed. So on the 10th of September, it is World Suicide Prevention Day, and you've been leading our work within the organisation around suicide prevention. Could you just start by talking a bit about the narrative around suicide? And we talk a lot about breaking down stigma in the NHS, but stigma around suicide and some of that narrative would be great.
Yeah. So thank you for having me. The theme for the World Suicide Prevention Day for 2024 to 2026 is changing the narrative on suicide. And that's been chosen because there is a need to change how we have these discussions around suicide. And also we're all encouraged to break down the stigma around having those conversations. I would just like to tell people there are ways. It's never easy to have these conversations around suicide. But if you do have anyone who is struggling with, you think is depressed or might be suicidal, there are certain tips we could give, on having those conversations. It starts with them having, with an open-ended question. Okay, how are you? How do you feel? Could you tell me how things have been? Something that encourages the person not to just answer in yes or no.
Okay, to open up.
Open up. The other thing is go with resources when you want to have those discussions with someone. And we encourage people to offer our helpline, which is 0800 953 0110. Okay, so we encourage you go with or any other resource that you know around suicide before you have those conversations. Okay. The other thing is don't judge the person. Okay. One thing with having a conversation around suicide is the reason why the person is suicidal might not make sense to you, and it doesn't have to make sense to you. Yeah. It's their own emotional pain, and we all react differently to different things. We all got different levels of resilience. Yeah. So people tend to quickly jump to, oh, is that what's making you suicidal? No, you don't want to do that because that's not the focus. The focus should be on getting them help. Okay. The other thing is give them time to talk. Yeah. It's really important to listen calmly and patiently. It's not the time to tell your story. It's their time. Yeah. Just listen to them. And that might just be what gets them, that encouragement to seek help. Also take them seriously. If someone is able to share with you their struggles, you should take them seriously and see how you can support them. The other thing is ask sometimes directly. Okay, about suicide. Are you feeling suicidal? Yeah. Are you thinking of ending it all? Okay, because research has shown us that asking doesn't increase the risk of suicide. Okay. So we know that initially people were concerned if I asked, would it sow the seed in the person's mind? No, it doesn't. Okay. It actually helps them to open up a bit more and then seek help. So those are the tips we'd like to give people listening if they want to have those conversations. It could be a friend, it could be a family member, it could even be a patient. That's it.
No, that's really, really helpful, Raphael. And there's talk about the orange button scheme that was launched 4 years ago. I think it was early 2020, wasn't it? And yes. How does that work?
So the orange button, driven by the ICB, which we are, tied into as well as a trust, and we support. Essentially, it's a community scheme where people are trained or to have these to talk to people who might be feeling suicidal and be able to offer them signposting.
So it's individuals within communities that have had extra training around. Okay.
So, and once you've completed the training, you're given an orange button, which you can actually wear.
That visible reference.
So so the whole idea, we should be promoting the orange button so people know if you see someone wearing it, it means you can approach them and talk to them.
Yes.
And they won't counsel you, but they will signpost you. And we also know that if you've had any mental health first aid training in the last 2 years, you can automatically apply for an orange button and you will get that. Wow. So it's all about that community approach, getting people to access help because, for instance, the data we have for the period 2011 to 2021 from the National Confidential Inquiry into suicide and safety in mental health, NCISH, we know that for the area LSCFD covers, 22% of the deaths by suicide were those who were in contact with mental health within the last year prior to their death.
Okay.
So the national figure is 26, ours is 22. So it means that there are a large number of people who weren't in contact with mental health service within the year prior to death.
Yes.
And so that's why, again, in line with the national strategy, we need to make it everyone's business.
Yes.
Because we won't see all the people who are feeling suicidal.
I didn't realize that the orange button can be in business windows, in cars. It's there to raise that awareness and start that conversation.
That's it.
And then bags of strife. I'm sure I've seen this on a recent news.
Okay. And this primarily focuses on people who have been bereaved by suicide because they are at risk themselves of suicide. Okay. And so the bags of strife are offered free of charge by a charity called Bags for Strife.
Okay.
And these are people who have been personally bereaved by suicide. Yeah. So they have lived experience of being bereaved. Yeah. And what they've done is they put together a bag that contains things that helped them when they're going through those difficult moments. Yes. And so it's a really useful bag. It's got quite a number of things. It's got, because sometimes people who are bereaved, having a meal is a difficult thing. So there's a chocolate there. Okay. There's a candle, scented candle. There's a spray with aroma that could help with sleep, because sleep problems could also occur. There's there's a book that has people telling their own stories of how they dealt with bereavement. Then there's a journal for you to write if you want to do that as well. So there are quite a number of useful resources there. So it's available in the trust.
Okay. And
people could contact the engagement officers. Okay. So it's available free of charge for anyone who might be struggling with
Wow. And another part, we talk a lot about breaking down that stigma and across the whole of mental health. And one area that and raising awareness of different conditions. One area of suicide I wasn't aware of until doing the reading for today was around suicide and the menopause.
Oh yeah.
And that is research is coming to the fore in that area now.
Yes. And the Royal College of Psychiatrists is trying to push that. Okay. The last Congress this year, 2024, featured that as one of the webinars, the modules, and they have a very useful learning module on the e-learning platform for the Royal College. And basically what it is so some data points to the fact that amongst women age 40 to 50, 45 to 54, suicide rates are high.
Okay.
And this happens to coincide with the period of perimenopause and menopause.
Yeah. And
the thing is, people struggle with, data has found that some women develop first onset mental illnesses during the period of perimenopause and menopause. And some who already had mental illnesses, it becomes worse. Okay. And the problem is because of the hormonal changes that occur during the perimenopause and menopause, it affects mood, sleep, and several other things that could itself predispose to having a mental disorder. And if we are not aware of this, then whatever treatment we're offering will be less likely to be effective.
Okay.
And so the focus is we're trying to drive a practice change among psychiatrists and mental health professionals to ask, as part of history taking, take history about menstrual history, menopause, and hormones. Okay. And that might just because the patient might not know that this is what's causing, the mental health problems. And if you don't know, then you can't help them.
Yeah.
So, and it's an recognized aspect of, the relationship between menopause, women's health and mental health. And so the aim is to try and create more awareness and drive people to think about this, because once you do find that it is contributing to the mental illness and you provide the appropriate treatment, often in collaboration with other specialists, you find that treatment becomes effective. And sometimes it's been found that you might not even need the antidepressants anymore. Okay. It's actually the hormonal changes that were causing the problem. So as a trust, last week we did have, I did speak at the LAP, local academic program, initially about 20 minutes to try and promote this. The trust does have a menopause champion.
Yes.
And so hopefully we'll continue to do that.
Brilliant. Thank you very much. And earlier on, Raphael, you talked about if somebody is worried about somebody that they know, or them themselves might be thinking that suicide is the only option for them. You gave the helpline number.
Yes.
What other resources are out there for people that are struggling with this, either personally or on behalf of somebody else?
So what we're also encouraging them is to search the orange button, because from that, you get an access to a directory of services.
So that's the hub to go to, is the orange button.
So you can go there or call our helplines.
Our helplines, and they're all on our website.
They are.
Yeah. No, that's really, really helpful. And I think, it's just been really interesting. I think that the extra awareness that around this, and as you say, the topic around changing the narrative for World Suicide Prevention Day. So important. So
it is.
Just a massive thank you, Raphael, for joining us today.
Thank you. Thank you for having me.
Thank you very much. I hope that's been really informative for listeners. And please do reach out to that orange button or any of our website with any of the addresses on there to support during this anything you've heard today being discussed.